Sickle cell disease is an inherited blood disorder that turns normal round blood cells into misshaped cells that look like sickles or crescent moons. We spoke with Dr. Thomas Coates and nurse practitioner Debbie Harris of Children's Hospital Los Angeles to learn about the diagnosis and treatment for this disease.
Sickle cell anemia is a genetic difference in red blood cells that occurs most commonly in people of African American descent. About 1 in 400 African Americans have the disorder. And normally red cells are very flexible and they can move through blood vessels very easily and deform. Patients that have this genetic difference in their red cells or in their hemoglobin have very rigid red cells, and so when the body takes oxygen out of the red cell, which is the function of the red cell, is to deliver oxygen, then the cell transforms from being very flexible into being very rigid. It takes on a sickle shape like the sickle that you would use to cut hay with, and that's where the disease gets its name. And these very rigid cells then block the flow of blood and result in damage to the tissue because the tissue farther down the line can't get blood and can't get oxygen. The most common symptom of this is episodes of excruciating pain because the blood cells block flow to bone, and this causes death of the bone, and this causes very severe pain similar to what you would experience if you break a leg or break an arm. The same damage to bone also can occur to their brains and kidneys and lung and other parts of the body, which can result in life-threatening complications as well. But the pain is the hallmark. Kids are born with it, and it's usually detected in California and most other states through a newborn screening program. However, the clinical manifestations of the disorder don't really start until the child's about 3 or 4 months of age. There's no easily available curative treatment at the present time. So mainly we try to manage the complications and prevent the complications. There's really a lot of hope for this disorder, and there's a tremendous amount of research, as you're probably aware, going on with molecular biology and the ability to actually change genetic messages. And there are individuals who are already hard at work trying to correct the genetic defect in sickle cell disease and come up with a way to put the corrected gene into kids that have the disease and take it away. So I think at the present time, from a clinical side, we're very focused on many kinds of research that is aimed at preventing these complications, and hopefully when a cure is available through gene therapy, the children will be in very good clinical shape and will be able to make the disease go away altogether.
The sickle cell program at Children's Hospital includes a multidisciplinary team. There are 5 physicians here. The director of our program is Dr. Thomas Coates. There are 4 nurse practitioners with the sickle cell program, and we have 1 social worker. We also are really lucky to have a huge team that we can refer to, since sickle cell can affect all your different body parts, your mind, your body, and your soul, everything. And we follow approximately 350 kids with sickle cell disease in our center. We're the biggest sickle cell center in Southern California. Sickle cell disease definitely can take an emotional toll on the family, and support and coping are vital for the child to do well. We work closely with the Sickle Cell Foundation of California, who is a support group that provides educational symposiums and parent support groups to help, and summer camps for kids with sickle cell to help them cope better. Many of our children with sickle cell disease need blood because they've had strokes or damage to their lungs, and we just simply do not have enough blood for them. And we really encourage all persons, especially persons who are African American, to donate blood to help our kids.